We're now joined by Dr. Hisham Fawaz, head of the Hospitals Department at the Lebanese Ministry of Health, to discuss the alarming state of Lebanon's healthcare system amidst relentless airstrikes and rising violence. Dr. Fawaz, thank you very much for joining us. Lebanon's healthcare system has been severely impacted by the recent airstrikes. Now, can you give us a sense of how these attacks have affected hospitals and healthcare providers across the whole country?
Yes, thank you so much. Good evening, everyone. I will present some numbers for the public just to know what we are suffering. First of all, we reported around 268 attacks on the health facilities between hospitals, primary healthcare centers, and EMS teams or emergency medical teams. We have 163 deaths. We have 262 injuries. We lost around 158 hospital. We lost, 158 ambulance, We lost around 37 fire trucks, 15 rescue vehicles. All these big numbers are the attacks reported on the healthcare system, which is not acceptable by all means, which against Geneva Agreement, which against all international agreement, UN laws. Israeli army are not respecting any international law, are not respecting any international agreement. They are attacking journalists, they are attacking hospitals, they are attacking EMS teams, which again is putting a lot of pressure on our health system, because till now we lost already 8 hospitals totally out of service. 7 hospitals are working partially, which means around 15 hospitals which are out of the system, which is putting additional stress and additional pressure on the other hospitals, on the other governorates.
Mm-hmm. Dr. Fawaz, now with 268 attacks, as you've mentioned, and 163 lives lost in the health and hospital sectors alone. Now, how's the Ministry of Health coping with all the loss or in the human toll of this crisis on the healthcare workers?
For sure, we are really sad for such numbers. For sure, our healthcare system is suffering. The situation is very critical. It's very dangerous, because day after day, the attacks are continuing, are growing, which is putting the whole system on a high risk. Till now, we are managing by transferring patients and injuries between hospitals from front lines to Beirut and Mount Lebanon. We are trying to make always, or to have the balance in the system. Also, we are evacuating sometimes some patients from areas to another areas. But again, we are suffering, the AMS teams are suffering, sometimes are not being able to evacuate injuries. Yani, sorry to tell you, but till now, since 10 days, we have 8 medical team, 8 members from EMS teams with 3 ambulances. They are still in their ambulance deaths. Israeli army are not allowing to ICRC or to Lebanese Red Cross to evacuate the 8 EMS martyrs. Yani, we have healthcare workers that are died by attacks, and we are not allowed to evacuate them even since 10 days. So here you can see how much Israel are not respecting any law, are not respecting any UN law, let's say. Even though the situation is still under control, we are still being able to manage. Why we are managing? Because already we prepared our system since 1 year. Lebanon health system is already a strong system, but for sure, our capacity is decreasing day after day. The pressure is increasing day after day. If these attacks will continue, if we will continue losing hospitals out of system, that will create a big problem in the near future.
Mm-hmm. And with the transfer of patients from one hospital to another, or from one clinic to another, and as you've mentioned, a lot of ambulances have been destroyed, are they having any safe and secure transport route? Are you setting up hospitals within the fields?
Sorry, there is no secure any transportation. Our EMS teams, our medical healthcare workers are heroes, to be very honest, because they are not taking any guarantees, any security from anyone. And sorry to say that, even Lebanese Red Cross, many times they take the green light or the deconfliction light, which is known between UN. But even after taking the deconfliction and taking the approval by the Israeli side, they are being attacked. Yani they give the approval when the LRC or the team is going to evacuate someone. Many times they were attacked, and also that's give you a full picture with who we are dealing with, an enemy who is not respecting even his words.
Mm-hmm. Dr. Fawaz, now, are you receiving any sort of help or assistance from the WHO, from other international health organizations during these difficult times in Lebanon?
Yes, we are receiving already. We received around 100 wounded kids from WHO and UNHCR together. We are receiving support from UNICEF. We are receiving support from Egypt, and here I would like to thank Egypt. We are receiving support from UAE, KSA, Kingdom of Saudi Arabia, and from Qatar also, from Turkey, from France. We appreciate any support that we are receiving. We highly appreciate all the support that we are receiving. But I believe Lebanese people, the real support that they need in this moment is a ceasefire. A ceasefire today before tomorrow.
Mm-hmm. What about the medical supplies? Do you have enough medicine? Do you have enough portable and mobile ICU units? Are you having enough oxygen tanks? Are you having enough gas for the hospitals and the makeshift clinics?
As I mentioned before, to be very honest, the situation is very critical, but still under control. We didn't lose control. For sure, we have deficiency in some medication. We are requesting from our partners, from the countries that are willing to support our needs. We have also deficiency in the chronic medication. We don't want to forget the health needs for the displaced. We have around 1.2 million displaced people inside Lebanon. 25% of Lebanese population are now displaced. These displaced people have a lot of medical and health needs, especially chronic and acute medication. Already, as a Minister of Public Health, we distributed around 2 million packs of medication between acute and chronic medication.